evening. Nashville Mayor John Cooper is demanding an apology tonight after an inaccurate news report went viral.
That report claimed Cooper tried to keep the low number of COVID cases at bars and restaurants a secret so he could keep them closed. Investigative reporter Ben Hall has been looking into this.
It made headlines across the country. Accusations that Nashville Mayor John Cooper intentionally hid low numbers of COVID cases in bars and restaurants.
Did you try and keep low COVID numbers secret?
No. Right. No. And at the time, we were very transparent.
The mayor sat down for an interview to clear up any misinformation being circulated. The fact is, his administration did release the numbers he was accused of hiding. They were released publicly during a press conference and were reported in this article in the Tennessee Lookout back in August. It said there were only about 80 coronavirus cases traced back to bars and restaurants.
People are not always perfect in emails.
But critics seized on select emails that showed the mayor's office questioning whether the numbers should be shared with the public.
You can go through people's emails. I think apparently there's one it says not for public consumption. I think that's a staff member communicating to the public health department that this is not going to be in a press release.
Several national media outlets picked up on the report. It was even retweeted by Donald Trump Jr.
The fact that there's a political messaging machine that likes to double down on mayors and on Democrats, that's part of 2020. But it doesn't mean that it's not, in effect, a manufactured story.
So you think it's a manufactured story?
Well, I do.
Conservative commentators like Tucker Carlson on Fox News called on the Nashville mayor to resign.
There are some that have called for your resignation.
Oh, impeachment. Tucker Carlson impeachment. I want to invite him down to have dinner with me. If he thinks Nashville is not open, that we're not open for business, he should come on down. I'll bring a mask. I'll give him a mask. We know locally that this is not true.
But it is true there is major concern from downtown business owners who think Cooper's COVID restrictions are too tough and putting them out of business. And when they see far fewer cases traced back to bars and restaurants than at construction sites and nursing homes, they question why they're being targeted.
Given the crisis that existed, the question always is, have we been tough enough? We went from phase 2 to phase 3, and then boom, we weren't ready for it. Our disease super spiked here.
Cooper says Nashville had one of the highest rates of any city in the country back in July.
You want to know who really wanted us to close bars? Staff.
Cooper says while he is slowly reopening bars and restaurants, he is always looking at the numbers and may have to shut things down again. He insists bad press won't change that.
It's the national media that's projecting a story that's not really true that we know better than. Well, welcome to 2020.
So Cooper ended by calling the allegations in the report fake news. He called for an apology to the people of Nashville from the Nashville TV station that published the initial report.
All right, thanks so much, Ben. And as Ben mentioned, the mayor has faced those allegations that his office covered up the low COVID numbers inside Nashville bars and restaurants. But we found video that shows he and his team openly talked about those numbers.
Our public health investigators have found a record number of clusters originating from bars within the past week, which have affected.
On July 2nd, Cooper noted that several bars have been forced to close because of COVID outbreaks, and the chair of the Metro Health Board was asked for specific numbers.
What we're seeing is there are about at least 10 locations around the city that have had at least a total of 30 people confirmed that have tested positive, and these are Davidson County residents. There's maybe others who are at these locations that live outside of Davidson County. They may have been infected. And
health experts say tracking down specific numbers in tourist hotspots is difficult because people often will not get sick until they're back home, frequently in other states.